Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, we're going to talk about itch. Being itchy is one of the worst feelings. If you have had a bad itch, you know how terrible it can be. Itch rivals pain for making humans feel really uncomfortable and somewhat miserable. Itchiness can be from many different things. It can be from a simple bug bite, or a bad case of poison ivy, or another allergy. Can be from dandruff of the scalp, could be eczema. The most common reason that I see people complaining of itch is because their skin is so dry. So today, I'd like to start by taking you through a typical consultation that I do in my office for an itchy patient. The first thing that I do is I ask, of course, when and where the itch started and how long it has been going on. Then I usually confirm that it is worse at night, which is almost always true. Itch is always worse at night because basically the nerves in our bodies are connected and they go all the way from the skin through the spinal cord into the brain. And when our brains quiet down in the evening and are less busy focusing on all the things that we have to do for the day, they get to focus more on bodily sensations such as itching. So itching worsening at night is common. It's a mind-body connection. Once I figure out generally the where and the when of the itch, then we look at the skin. This is one of the best parts of dermatology. Each patient is like figuring out a puzzle, and some are easier than others. Itching can be a tough one, but if there is a rash on the skin, then I either almost immediately know what it is, since it can often be something obvious like bug bites or poison ivy or eczema or an allergy or hives. But if there's a rash and I don't know what it is, the other great thing about dermatology is that we can take a small skin biopsy, which is a little bit of minor discomfort. We take a tiny piece of skin and we send it to the lab, where the dermatopathologist can tell us what it is. I'd like to go into a bit more detail about some of the common rashes that do cause itching. First is scabies. Scabies is pretty annoying. People are incredibly itchy. They're usually scratching in front of me in the room. If somebody has scabies, we have to shut down the room and do a deep clean on it so we don't see any other patients from that room for the day. This is not that common, but it does happen on occasion, and it's from scabies mites that live in the skin. It's typically gotten from another human being that you have close contact with. It can be gotten from your dog if your dog is itchy. Sometimes patients have a rash and they have little bumps in the web spaces of their hands and feet or around their belly button. Or someone else has scabies, and so you kind of know that that's what they have if they caught it from the other person. But we can definitely treat scabies with creams or pills and get rid of it. Another common rash that we see that causes itching is dandruff of the scalp, otherwise known as seborrheic dermatitis. And in the scalp, patients often see flakes, and then they think that it's very dry. And so they stop washing their hair because they think that that's going to help. And really, the whole problem gets worse when that happens because the flakes are being caused by a yeast overgrowth. And the less you wash it and the more you put conditioner on it, the worse the flaking and the itching is going to be. So this is also fairly easy to fix with rotating shampoos, such as dandruff shampoos like Head & Shoulders or Selsun Blue or Nizoral, which are all available over the counter. Also Jupiter, which we sell in our office and is available online. If rotating shampoos and washing your hair more frequently does not work, we can use topical prescription steroid solutions. And also there's always oral antihistamines, which are available over the counter like Benadryl or Claritin to help with itching. The third very common rash I'd like to mention is something called notalgia paresthetica, which is sort of a weird name, but it's a itchy patch on the back. It's often due to a pinched nerve. If it's mild, it responds to moisturizers, topical steroid creams, sometimes numbing creams. But if it's severe, patients often need to be put on a pill called gabapentin, which is a nerve medicine. Personally, I send them to the neurologist for that, but there are some dermatologists who prescribe this. Fourth brief mention for itchy rashes is hives. Hives look like bug bites, but they come and go within 24 hours. They do not stay in any one area. And they can happen for many reasons. The most common are a food allergy, a medication allergy, or an illness, particularly a virus. And if we can fix the underlying issue, then they can resolve fairly easily. We tend to treat these with oral antihistamines. Again, they are over the counter. Benadryl, Claritin, Allegra, Zyrtec, Zizal. My favorite is Allegra during the day and Benadryl at night, but some patients have different preferences, and that's fine. I'll make a brief mention here on bug bites since they look very similar to hives, but they don't come and go, they come and stay. And as long as the offending bug is gone, they stop and resolve on their own, or they can be treated with topical steroids and oral antihistamines. Another reason for an itchy rash is poison ivy or other contact dermatitis, so an allergy to something that your skin comes into contact with. Summertime, gardeners or hikers often get poison ivy. You can also get that from your dog. If they've been running around in the poison ivy and then you pet them, you can get it from them. But it's also common to get contact dermatitis from chemicals in products that you're using. So this is a common cause of an itchy rash. And then I'd lastly like to mention eczema, because eczema is a very common cause of an itchy rash. There's a whole podcast on eczema if you want to take a deep dive on that. It's more common in children, but adults can have it too. And it can be pretty miserable. If it's not resolving with good moisturizer and prescription creams, there are other treatments such as light therapy and also medications such as Dupixent. So just to do a brief review and hit the high points here of the rashes that are common causes of itching. Bug bites, they go away, can be treated with topical steroids. Poison ivy or other allergy goes away, can be treated with topical or oral steroids. Eczema has many treatments. We focus on moisturizing, and we can hit the trouble spots with prescription creams. Hives usually respond to oral antihistamines or figuring out what the offending agent is that's causing it and stopping that. Scabies we treat with prescription creams. Dandruff or seborrheic dermatitis we treat with rotating and increasing shampoos. And that's sort of the common rashes that I would see. And that is a lot of information. But I want to go over the most common cause of itching that I see, which is just plain old dry skin from too much soap and scrubbing and hot water and not enough moisturizer. And this is so easy to fix by using less soap, cooler water, and tons of moisturizer. Sometimes it is hard to change people's showering or bathing habits, but if they are itchy and uncomfortable, they are often motivated to fix the underlying issue. I do have a whole podcast episode on dry skin and how to fix it, so if this applies to you, please go back and listen to that. Dry skin is very easy to fix in most cases. So patients who are complaining of itching for whatever the underlying cause, I will often put them on over-the-counter antihistamines such as Benadryl at night or half a Benadryl, and then Allegra or Zyrtec or Claritin or Zizal during the day. My favorite is Allegra, but other people can choose which one they prefer. These medicines prevent the release of histamine, and histamine causes redness and swelling of the skin and itching. I also often recommend Sarna lotion, which is an anti-itch lotion that is available at the pharmacy or online, S-A-R-N-A, Sarna, and that can be used many times a day just to help with some relief while we're waiting for the underlying issue to be resolved. Ice packs or cold compresses can be helpful. Sometimes a mix of ice water and milk can be helpful to soak irritated, itchy skin. Some people will use frozen peas as a good reusable ice pack and keep it in the freezer. I will use oral steroids only for very severe cases because they have many side effects, but sometimes people do need oral steroids. So I just went over the most common causes of itching in terms of rashes and dry skin, but what about the patient who has no rash? This is the patient of most concern because severe itching with no rash can mean that they have something wrong internally. So that patient with severe itch and no rash gets a more intensive workup. I will usually send them for blood work, looking for liver or kidney disease or an infection. I will also send them for a chest x-ray to rule out a type of lymphoma. I instruct them to make sure that they are up to date on all their appropriate cancer screenings, such as mammograms, colonoscopies, pap smears, etc. If the patient has no rash, their skin is moist and not dry, everything in their itch workup, such as the blood test and the chest x-ray, is negative, and they are still really itchy, and there are no underlying problems or rashes, then there are other treatments that can be given. The treatment I usually like to recommend for severe itching with no underlying cause and the patients are otherwise healthy would be ultraviolet B phototherapy. I do not provide these in my office, but I will refer patients to another dermatologist for this if they need it, and it usually works well. So in summary, there are many causes of itching. The most common causes of itching in my office are dry skin, bug bites, poison ivy, other allergic contact dermatitis, hives, scabies, seborrheic dermatitis, and that is in no particular order. These are all very commonly seen conditions in dermatology offices. If the patient has no rash, it is important to rule out internal disorders such as lymphoma, kidney disease, liver disease, among others. I hope all this information is helpful in thinking about how to approach a patient with itching. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.